Vandana, first of all, for having given me the opportunity to make a presentation here. I'm Dr. Lavanya Seshasayee, and I'll come straight to the point. I think, I'll be talking about how we could promote self-advocacy in the field of mental health, and how this would be of some use to users and consumers and survivors, people who want to be survivors. Now, this is a predominantly user-survivor narrative, and it needs to be analyzed since these narratives provide cues of how clients may be rehabilitated, and I shall summarize my own history to begin with. And then I shall make theorizations to suggest what is in need of change. So, my only request is that you just listen to this whole thing completely, and then make your points, jot down your points. Whatever you want to ask me in the end after I complete, because otherwise the focus of the discussion tends to shift. So I'll start off with my history. I was born into a traditional South Indian Brahmin family that laid down specific and separate codes of conduct for women and men. There was this societal double standard that implied that the boy could be as independent, assertive, vocal, and ambitious as he wished to be, whereas a girl could not. So women were not expected to be very good at masculine vocations like mathematics and engineering in my family. They were expected to be vehicles for the transmission of familial culture to the next generation and find happiness via their traditional vocations as good wives and good mothers. I didn't want to stick to this role, and I was told by my elders to stick to my role and not talk too much. So I launched a public protest, and I declared my non-conformity to the unjust unchallenged gender stereotype rules of society. I was intensely interested in solving mathematical equations and not cooking in the kitchen. The result was something that was so powerful in its very wickedness that it incapacitated me for a period of 5 long years. I was beaten, punished psychologically, was stripped of my dignity by my own mother, who was motivated by my jealous aunt to make me work like a donkey on the pretext of giving me a proper upbringing. I was made to sign a bond on which were written the words, "I will pay for all the food, the boarding, and the lodging I receive in this house by performing all the domestic work in this house." I went mad because of the torture that was meted out to me by my jealous aunt, who played a very dirty game. She said I needed to be disciplined for my own good and drew up a timetable to make sure I did all the work I was supposed to do as a girl every day. I was driven crazy by this stupid system, and for the next 2 years I was simply unable to study. I was talking incoherently to my classmates in college without even being aware of it, and became the laughingstock of all my classmates. I performed badly at academics and was disrespected by teachers and fellow students. This resulted in a loss of identity, and I failed in my 12th standard. And there was tremendous pressure on people to perform in their 12th standards. And so after I failed in my 12th standard, I was treated so badly, I thought I did not have alternatives and wanted to commit suicide. And that was when I approached the mental health sector or the mental health system for help. Now, what were the intricacies and dynamics of the help, the so-called help, that the professionals offered me? They had been unable to help me.